reserve. I believe it was the Army Reserve came in to help and staff the command center that I was at. So I was, helping to train the Army to do the work that we were doing. And there were some other people from other regional health departments coming in to help, and slowly contact tracing was starting. And slowly, every so often, we would get somebody in the command center would get a call saying that they were someone who was exposed, and they'd have to leave. And that got really scary for me. Especially, like I said, I have a brother who has a lot of health conditions and is immunocompromised. So not that I was living with him at the time, but it just all became very surreal, thinking about the different ways the situations could play out, and people that, am I going to get sick? Am I going to get somebody else sick? Because this is so new. And there were definitely moments where it was scary, but I did stick out my time there, and I felt supported by the person running it. They did let me know, if you feel uncomfortable at any time, you can go. And I really valued that support.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to episode 120. Hi everyone, Omari Richards here. Thank you all so much for joining me once again. If this is your first time joining me, be sure to subscribe so I don't miss any other great public health information. Leave a like, leave a 5-star review, share with a friend. Greatly help that this show and other episodes in it help you navigate your career. Just get more information around public health. Follow me on Instagram, join the community and health wellness Discord at thephmillennial.com/join. Enjoy this episode a lot. Enjoy talking about health at everybody's size. Enjoyed hearing about this person's experience of being in New York, working in public health when the pandemic started, how she volunteered herself to do a lot of this work. And I think it's just very impressive. And I look up to that work. And I'm really grateful for people like herself that put themselves in a place where we didn't know what was happening, but put themselves in there to help other people use the skill sets that they have learned to be effective in public health. Hopefully it's a once in a lifetime thing that happens, but here we are in 2022. We will see where we go. Anyway, enjoy today's episode. Today we have someone who's passionate about infectious disease, One Health, biosecurity, sexual and reproductive health, and public health surveillance. She got her bachelor's degree in psychology at Marist College, then went on to get her Master of Public Health at City University of New York, or CUNY, Graduate School of Public Health and Health Policy. She currently works as an epidemiologist at the New York State Department of Health. We have Stephanie Parenti, MPH. Welcome to the show.
Hi, thanks for having me.
It is my pleasure. I know we connected, I think it was at a book club, maybe over a year ago, and then we connected on Instagram.
Yes.
Yeah. So I'm always happy to connect with other public health people, and happy to tell your story. How are you doing, and how are you coping during these times?
I'm doing okay. I'm no longer working COVID, which has given me a chance to kind of go back to some of my regular work. So that's been a nice change, but I know, MPV has been causing a bit of a stir, and I'm ready to assist, with that if or when needed. So, coping strategies all have to be ready to go. I go to therapy regularly. I try to get out there and hike and spend a lot of time with my dog.
Yeah, all important stuff. And do you have any particular places that you like to hike?
So I'm somewhat new to the area. I moved up to Albany, New York, which is the capital, for work. So I've kind of just been starting to explore hiking in this area. There's a Plateau Alliance that I've really been enjoying, going to all of their community forests. So I've just been doing a lot of exploring.
Yeah, as you should in a new place. So I'm glad that you're able to get out there. So tell us, how do you identify, and then tell us a little bit about your personal background.
Okay. So my pronouns are she, her, and I also identify as queer. I am from New York, and I grew up in a bit of a tumultuous home. So my younger brother had a lot of serious health problems, I think, which is part of what drove me towards health. and we grew up around domestic violence. So I think that that's something that has really shaped what we have done and what we've chosen to do in our lives, me and my brother. I am also fat and I have a physical disability, which has given me a lot of perspectives in medical fat phobia and body liberation justice movements. Um, and I'm also ethnically Jewish, which I think has formed a lot of values in my life. So those are kind of my identities.
Yeah, I appreciate that. And if you don't mind sharing, what does your brother do related to health?
So he is doing more the justice side of things. He just started law school, and I'm very proud of him. And he wants to work in social justice law. You know, he's just starting out, so I think he's still finding his niche. But I know he wants to work in social justice movements within law.
Okay, so awesome. Shout out to your brother. I'm sorry that all the things that you had to go through to get to where you are, but I'm glad that you are where you are and that you're able to do the work and share the story of getting there, as well as understanding like I feel like a lot of people say, "Oh, I want to get into health," and then they go into various aspects of health. But I'm glad that you're in public health because this is a podcast about public health, and we love public health. So, as I say that, what does public health mean to you? And now a quick break from our show sponsor. Have you been interested in connecting with a community of people who are passionate about community health while working on improving their own personal well-being? Well, lucky for you, the Community Health and Wellness Discord server is where you want to be. It's a free online community I co-created just for people like you. You'll find friendly people talking about important public and personal health topics, asking amazing questions, sharing valuable information, while connecting with each other to build a better culture of well-being personally and at the community level. Join this free online community by going to thephmillennial.com/join. That's thephmillennial.com/join. See you there. Now back to the show.
That's a hard question because it means a lot. You know, I think it means love for my community and promoting health of the greater community, and meeting people where they are. And recently, I also think that taking a One Health approach to public health is extremely important at this time, because we're facing health challenges that we've never faced before, stemming from climate crises leading to, you know, things like environmental racism and water contamination and increased zoonotic and vector-borne diseases that we've never experienced quite like we are right now. So I really am an advocate of One Health, which kind of brings together public health and environmental health, agricultural health, and environmental health. I might have already said that. So that's something that I've become really interested in.
Okay, well, I appreciate you sharing that. And when did you become interested in One Health? Because you're an epidemiologist. Granted, like there are many aspects of getting involved in One Health work, but I'm not too sure if that was like your general path or if you were an epidemiologist or liked epidemiology and then only now have seen, okay, this climate thing makes us, well, we're very connected. Us, our planet, and the animals that we live with are very, very connected, as we can see over the last 2 years, as we can see in climate change and on all the things that you mentioned. So when was that thought process? And I might be getting ahead of myself, but
Yeah. So I think within the past 2 years, I realized that it had a name. I think it's things that always existed side by side for me, looking at, you know, environmental health and climate change and environmental racism and how all of those things are connected. But I think probably the past like 2 years or so, I listened to a podcast called This Podcast Will Kill You, and it's a public health podcast. And they named it for me, and they're big proponents, the epidemiologists on that, of One Health. And that's when I kind of clicked for me that like, oh, this has a name. This is One Health, and how all of these things are connected. So since kind of learning that there was an actual term for it, I've been a big advocate of it, and I would love to be able to do more work that focuses on it.
I love that. And I'm guessing just because you're saying that now on this platform, someone else is going to know about One Health and then they're going to be more interested in it and get involved in it. And I think that that's how we need to be exposed to all these different aspects of public health, or just how we can help communities and, well, not help communities, empower communities to make the change that they need. So yeah, I love that. I love that.
Absolutely. I hope
Yeah.
so too.
Yeah. And before you got your bachelor's degree, you were a youth health promoter and peer educator at Planned Parenthood of Mid-Hudson Valley. Am I correct in saying that?
Yes, yes. So that
Okay.
was kind of my first foray into public health, into formal public health. So when I was in high school, I had the opportunity to become a youth health promoter and peer educator at Planned Parenthood. That was my local Planned Parenthood. So I was extensively trained in sexual health by Planned Parenthood, and then I was kind of sent to educate my peers and conduct community outreach. It was really funny. I actually kind of became known as like the condom girl at school because I was in high school, and Planned Parenthood themselves couldn't distribute condoms in the school, but they would they would pack me up with a backpack full of condoms, and they'd send me to school with dental dams and lube, and I would distribute them. My cell phone number even got out, and I would get texts from people asking me to, provide condoms, and we would meet up and I would do some education. And I really enjoyed being a source of, sex positive information for my peers. I was able to set up a course for caregivers and their teens to come together to learn about navigating communication about sexuality. They gave me the chance to do some lobbying in Washington, D.C. for reproductive health, which I really enjoyed. And then I eventually went on to train other teens to become peer educators as well. So it was a really formative experience for me, and it was my first real job.
Yeah, that is amazing. Shout out to you for being the condom girl, condom person. I think it's important. I feel like every school should have a condom girl or condom person.
Yes.
That's not only handing out condom, but giving a little bit of health information. And that's very interesting that like your phone number got out and people would text you. But at the same
Yep.
point in time,
Be
when you
like, hey,
become
can you meet me in the library?
when you become a resource that the community needs, it's important. It's important. And but what was the imperative to get into this position or do this type of work, or was it just that the opportunity provided itself and you wanted to get involved, or how did that happen?
I believe they came to my school, and so they were allowed to come to the school, Planned Parenthood. They weren't allowed to distribute condoms, but they came to the school and they did a presentation, and they, said, hey, if anybody's interested in learning more, possibly, doing peer education work and getting paid to do this, come to a training. And I showed up with a few of my peers, and that's how we got that opportunity for that to be our first job and our first kind of look into public health.
That's awesome. And at that point in time, did you have the word for public health or no?
Not really. That's where I think I learned about it. That's where I kind of met one of my mentors, and I learned a little bit about, when I was going to college, because this was when I was starting to think about going to college, and I had asked her like, oh, I'm kind of liking this. What are your degrees in? And, she had told me she was working on her master's in public health. So that's kind of when I learned about what public health, what a tiny portion of public health was.
Yeah. And that's not unlike a lot of other people that I've interviewed. Like they go into this position and then they see someone with a credential or someone that is a student trying to get the MPH or something related, and they're like, oh, this is feel. And I think like to that point, being able to have exposure at the youngest age as possible is I think is very important, or it's just helpful in knowing that like this is something that you can do. Because for me, I didn't know that until I was scrambling for a master's program in public health. Fell upon me, but I fell in love. So here we are. And okay, so you got this position and you graduate high school and you got your bachelor's degree in psychology at Marist College. What was the thought process behind, I guess, psychology and Marist College, which is, I think, is a school that I actually got accepted to come to for university in
Oh, that's
undergrad.
funny.
I know, small world.
So I didn't start as a psychology major. I started undergrad as pre-med in the science major, as I think a lot of us do. I was a medical laboratory science major at first. And after my first year, I knew that I did not want to take any more chemistry or physics classes. I thought that I was really bad at math and that I couldn't do it. So I still wanted to stay in the health sciences though. So I was thinking maybe I would go into occupational therapy. I had some experience watching an OT do some work and I was interested in it. And that required a lot of psych courses. So I had switched to being a psych major and continued taking just the science courses that I would need for occupational therapy school prerequisites. Um, and when I took statistical research methods 1 and 2 for psych, that's kind of when I found out that I wasn't as bad as at math as I thought I was. It was just that my brain kind of was better at thinking about math in different types of ways, like statistics. And that kind of got me thinking back to public health and research. And that's kind of where I found that, maybe that's what I should look more into. And that got me thinking about different careers that I could put that to use for.
Okay, that makes a lot of sense. And not unlike many people having to go into undergrad and then figuring it out along the way and seeing how you can get involved and stay involved in like health related careers without having to do like organic chem and all of that stuff. Which yeah, with chemistry is hard. Granted, I have like a chemistry minor, but I got like a D in my organic chemistry 2 class, and that was okay for me to get my minor, which was a surprise to me. But yeah, here we are. Here we are. Okay, so while you were in your bachelor's degree, you had an internship at the Mid Hudson Regional Hospital of Westchester Medical Center. So tell me about that experience.
So I interned at Mid Hudson Regional with an occupational therapist who served in pediatrics at local schools. And I learned a lot at that internship. And while I found that I loved the science behind occupational therapy, I learned that it was not what I wanted to do as a career. I looked back at what I had enjoyed doing the most work-wise, and the public health work that I did at Planned Parenthood just kept coming to the front of my mind as the most enjoyable work that I'd ever done. I'd always been interested in microbiology and parasitology and infectious diseases. So this is kind of when it really clicked for me. And I remember texting one of my psych major close friends at the time and being like, I think I want to be an epidemiologist. And of course, the response was, a what? Because nobody ever really knows what that is. Of course, post 2020, everyone knows what an epidemiologist is now. But at the time, it was kind of like that's when it clicked for me.
Yeah, that's awesome, and I think that also goes to show the importance of getting experience and getting exposure to different things, because then you're like, oh, this doesn't feel as good to me as the other thing that I was doing. So let's try to focus more on what that's more related to that, which I think is very, very important. And yeah, thankful for the pandemic in the sense that epidemiologists are known. Granted, like they're very necessary. We have other public health professionals out there that I think don't get recognition, but that's neither here nor there. I appreciate my epidemiologists. I appreciate people that are interested in infectious diseases. So also while you were in your bachelor's degree, you're an epidemiology intern at the Orange County Department of Health. So tell me about that opportunity.
Yeah, so after realizing that I had experienced OT, which I thought I was, what I wanted to do, and realizing once I experienced it, I did not enjoy doing the work as much. I promptly called my local Department of Health to secure a summer internship with them. And that wasn't even for school credit. That was just to make sure that I liked it, because after having that experience, thinking that this is, OT was something I wanted to do, and then learning that I didn't like it, I wanted to make sure that I had the same experience with an epidemiologist and making sure that I did actually like it. And I realized just how important getting internship experience was at that point, and trying out whether a certain career might be a good fit. So while I was at the Orange County DOH, I worked on arthropod-borne disease surveillance with the county for the summer, and I really enjoyed it. I also got some experience doing occupational health inspections, which I also found to be really interesting. And my culminating experience there was helping to put together a conference to educate local health providers on arthropod-borne disease trends in the area, and how to report cases and diagnoses accordingly. So I found that that's what I really enjoyed.
Yeah, and I love that. I think that's what more people need to do, like try to get experience. Okay, let's say, okay, I want to do this, but you in your head you envision this being one way, but actually getting in the experience and putting yourself in that situation, I think is helpful in like formulating how you like what you want to do, and as we said, like just get those experiences and you learn from that what you like and what you don't like, and go from there. And that's also awesome that you were able to host an event. I think that's another uh, undervalued skill in public health, because people always need people to come together in some way or another. So that's awesome as well. And then you also got an internship as a public health intern at Planned Parenthood of Mid Hudson Valley. So tell us about that one.
Yeah. So after realizing just how important internships were in helping to determine whether a field is a good fit, I took another public health internship at with my previous mentor at Planned Parenthood that I worked for when I was in high school. And so during that internship, I was responsible for creating an evaluation tool to assess some qualitative and quantitative data being implemented by the sexuality educators at Planned Parenthood for quality improvement. So again, just getting a different taste of public health, this time doing some QA and QI and data related tasks rather than, like the disease surveillance that I was doing. Again, just to kind of taste different aspects of public health and see what I like.
Yeah, that makes a lot of sense. And I think it speaks to the next role that you had as well, which I believe you had in your bachelor's program and then going into your master's program. So before I ask about that role, I wanted to ask, just generally speaking, were there any big undergrad takeaways that you had?
Do your internships, get real life experience, shadowing people, doing different jobs that you're interested in. Because I learned that, while I thought I wanted to do certain things, they sounded like a good fit for me. I didn't actually enjoy doing them when I was interning. So it was really valuable to me to have internships. Also, having a mentor who was in the field was also something that helped me along the way. So finding a mentor and doing internships, and then also learning to lean on your community in undergrad and create those wholesome spaces. I was a member of the Hillel, which is a Jewish organization on campus, and I was the president of the LGBTQ plus organization in undergrad, and those are really just some of my favorite memories. So leaning on your community, finding a mentor, and doing those internships, I think, are my big undergrad takeaways.
Yeah, and to that point, like leadership as well, like getting involved in causes that are important to you. And you don't have to be the leader, but it's always helpful. And I think it's a great skill set to take into a master's program, or just to generally have in public health or whatever field you work in. And because you got a bachelor's in psychology from switching over from a lab science major, you said. So do you think like you covered most of what you needed in like the public health realm with a psychology degree in your undergrad?
When it came to like research methodology, that I think was covered pretty well in my psych major. I also think a lot that had to do with developmental psychology helped me when it came to like different types of learning and like educational processes and how um, people and society learn. I think that was helpful. And then I think, bits of my um, sciences were helpful. Like I said, I really enjoyed micro, I really enjoyed parasitology. So I think combining some of those things made me prepared. I don't know that I would have felt completely prepared if I had only done psych the entire time and didn't have like my public health internships and some of that science background that I had. But I think those things together had me prepared.
Yeah, I think that's important to like just highlight, even if you're in a degree that's more, whether that's research focused or whatever the case might be, there are ways for you to get experience, to get a varied perspective on different things you can do in public health or other fields through internships and other experiences like that. Um, and the last position that you had during your bachelor's degree, you started it during your bachelor's degree, if I'm correct. You were a health educator and outreach specialist at Planned Parenthood of Mid Hudson Valley. So first of all, I guess was this straight from internship into a position, or how did that work out?
I had one more semester before I graduated. I graduated a semester early. So I had my fall semester. And after that, right, that was in between bachelor's and my MPH, I worked at Planned Parenthood Mid-Hudson Valley as a full-time employee. So that was right after I graduated with my bachelor's. I returned to Planned Parenthood as a full-time employee. I did health education and I did a lot of grassroots outreach. So I did implementation of CDC endorsed evidence-based sexuality programs with youth. And then I did a lot of community outreach and street outreach, tabling in the community that we served. And then I served as a member on several community-based coalitions in this position. So it was a really good way to have ourselves in the community. And I really enjoyed doing that community work.
Yeah, that sounds great. And I think everything you're saying is you like doing that type of community work, and you put yourself in those positions to do that type of work. And it's awesome. But I also think that like you went to Planned Parenthood before in high school, and got the internship, then the position, and then grew from there. And I wanted to ask, like, when throughout that period did you know that you wanted to pursue a master's level degree?
I think I'd always thought I wanted to. It was always kind of an expectation I had for myself to do a master's level degree. It was just, I guess my parents had it and I thought that I was supposed to do it too. And, now we know that that's not what you have to do to be in the field. But I think I just thought it was the logical next step for myself. So I was kind of like, okay, well, my mentor has this master's in public health. So I guess that's what I'm supposed to do. So that's kind of where I went with that. And I started looking at different job descriptions for epidemiologists, and most of them did require an MPH. So kind of in doing the research for what I wanted to do, it became apparent that to do what I wanted to do, I needed an MPH or, a master's in epidemiology.
That's a great point, because I think a lot of people try to do work that might not be aligned with the position that they're trying to get to. And like, I think looking at job descriptions is very informative in that sense, as it gives you the degrees, the amount of experiences, the type of experience that they want you to have. And I think if you look at it early enough, and if you know that you want to be an epidemiologist, you can just, okay, these are the skill sets that I need. How do I get these? And then work forward from there, which I think is awesome. So you got your MPH at CUNY Graduate School of Public Health and Health Policy. What was the thought process? Well, you already shared the thought process. Sorry. was your concentration epidemiology, or was it something else?
Yeah, so I did my concentration in epidemiology and biostatistics. It's funny, this was before COVID hit, and I really loved like old school epi, boots on the ground, like infectious disease tracking, stuff like that. And we were in a time where we were very focused on chronic disease prevention. And I was like, wow, I feel like this kind of infectious disease stuff is falling out. And, they weren't even offering the infectious disease courses in infectious disease epi when I was there. And right as I graduated, COVID kind of hit, and I was like, they started offering the infectious disease epi courses again, and I was like, see, this was still relevant, and we still do need this focus on infectious diseases. But I was kind of between going to the CUNY Graduate School of Public Health and Health Policy, and Albany, also up here in the capital, has a public health program. And right at that time, I was living like smack dab in the middle. So I was looking at programs in both of those areas. And I just decided on CUNY based on the public transportation that was available. It, was in the city. I was able to take the train right in, and I did my MPH while working full time. And I don't. that was a crazy time. And I look back on it, and I'm like, how did I do that? But I did it, and I don't know that I'd be able to do it now. But I did. I don't know that I'd recommend that.
Okay. Granted that you might not recommend it, given that you did do it full time, what do you think were the things that were, or the things that you were able to put in place to make yourself continue to be successful throughout the MPH program while working full time?
That's a good question. I think, having the support of my family and my partner was really important in being able to do that. And honestly, one of the reasons, again, that I chose to go into this city, into New York City for this, was the public transportation and being on the train. I had a long train ride in, and I was able to get work done during that, which I couldn't have been able to do if I had driven up to Albany. I can't do work while I'm driving. So a big part of that was just planning that, okay, I'm going to have about 2.5 hours on this train. I can dedicate those 2.5 hours to doing my schoolwork. And it was kind of like an uninterrupted time, period of time for me to do schoolwork and really focus. And that was really valuable for me. So making the time work for you and taking advantage of those opportunities was, I think, really important in working full time and going to school.
That's awesome. And I love the trade-off there in understanding that, okay, I could either stay in like close to CUNY, well, not close to CUNY, I guess, because you're traveling, I think, an hour one way, but stay somewhere where there is access to transportation and you can do your work on that, or go somewhere where you have to drive and you can't do your work on that. Especially with the full-time job, that's definitely something that people can think about when they are getting any degree. I feel like just the livability, well, the transportation system and how easy it is to get around, which I think in many places in the US is not that great. Um,
Yeah,
so,
and that's a part of public health too. You know, our built environment is part of it.
yeah, come on, Pete. I think Pete Buttigieg is the what is he? He is the head in the government around
Yes,
like transportation.
transportation. Yes, he is.
Yeah, yeah. So he needs to do a little bit more, but that's not his fault. The systems have been built for a long time in the wrong ways. But thank you, Pete, for the work that you're doing. Um, so was that full-time job that you're talking about, the health educator and outreach specialist, or was that another job that I'm going to talk about?
That was my next one. I had gotten accepted to my MPH programs right at the end of working at Planned Parenthood and in the beginning of working at the next one that I think you're going to ask about.
Okay, and that next job is a trauma registrar at Orange Regional Medical Center. So tell me how you get into that job, and then what do you do with it?
So while I, of course, loved working at Planned Parenthood, as you know, it became quite a theme in my life. It was a bit of an unconventional schedule. I did a lot of outreach and events during the evenings and during weekends. So I did need something that was going to be a little bit more predictable when I started grad school. So that's when I went on to become a trauma registrar at Orange Regional Medical Center, which is a level 2 trauma center. And it was also a good time to be able to use some of my more statistical skills and my surveillance skills in that position, because it included a lot of data management of the trauma registry, which is, it tracks traumatic injuries for submission to the National Trauma Data Registry each year. So I had a more flexible schedule for me, and to be working on my MPH at the same time, and also just using some of those more epidemiological and biostatistical skills.
Well, I'm glad that you're able to have an opportunity. And I think another thing that you're touching on there is the importance of knowing the balance that you need. As you said, with the unconventional schedule, it was hard to predict how it would work for school, and knowing that for this period of time in your life, you would need something that's more, or it'd be a lot easier for you to have something that's more structured, where you can really figure that out and fit that into your school or around your school schedule, which I think is a great thing to think about. Once again, that probably a lot of people don't think about, but it's important. And during your MPH, you also had a role as a population health specialist at Health E Connections.
Yeah, so I worked at as a trauma registrar for a little over a year, and I had just found that the hospital setting wasn't where I wanted to be working. I missed feeling like I was working in the community in the same way that I did when I was at Planned Parenthood. So I went back to a more, again, kind of like boots on the ground public health position, which is what landed me at Healthy Connections. So I was a population health specialist, and I was responsible for developing and implementing regional programs to address and advance the goals of the New York State Prevention Agenda, with funding from New York State. So one of my favorite projects, actually, working on that was doing a first ever regional community health assessment for the entire Mid-Hudson Valley. And that included 7 different, counties, their local health departments, their hospitals, their service areas. And I was actually able to use that as my MPH internship. And then the project that resulted from it, I was able to use as my my culminating practicum. So that was really helpful. And another thing that I would recommend, people do, is look for opportunities within your current workplace to do your internships and your practicums and your final projects, because it really does help to have the support of, your job in doing the work that you're doing, and to be able, the convenience of being able to do it right there is really helpful.
Yeah, double dipping is very, very pivotal. I did the exact same thing plus another internship. But yeah, that I think having that support and just being able to do like one thing and use it for both the job that you're doing, but also for your MPH or whatever that might be that you need that experience for is helpful, because it's less draining on you from having to do like one job and then go do something completely different, as well as go to school and then have all that right up. That makes it a lot more streamlined. So I definitely advocate for that if you're interested in doing that. If you want to be more adventurous and do more things, that's all up to you. But know that the stress levels get a little higher when you're doing more than one thing.
Absolutely. Yes.
Yeah, yeah. And then after you graduated from your MPH, so did your MPH and the epidemiology concentration that you were able to do, like looking back on it now, how is it everything that you expected it to be? Did you gain everything that you needed?
I do think so. One thing about going to a CUNY school, a City University of New York, or there's also SUNY in New York, which is State Universities of New York, is that you are paying in state tuition, but being able to be in New York City, you have access to so much, and the professors that you have are the same people who are working within the New York City Department of Mental Health, and of Health and Mental Hygiene. So being able to have the experience of professors who are also working at Ivy League schools in the city. It's the same professors working, in both institutions, but you're just getting to pay in state tuition for it. So I'm a big proponent of doing city and university schools, and I felt, that I got the same education as somebody going to the same Ivy League school down the street was getting, and having access to basically all of the same resources as them. So I did feel pretty prepared.
Okay, that's awesome. So you graduated with your MPH, and I'm saying awesome again. I apologize. I'm gonna create like a jar for myself to donate money or something if I continue to say awesome. Okay. So after you graduated, you were a public health representative, disease intervention specialist at the New York State Department of Health. So tell me about that transition into that job.
So when I was about 6 months into my position as a population health specialist at Healthy Connections, we learned that our grant funding was at risk, and eventually it was taken out of the New York State budget. So at that point, I was pretty much almost done with my MPH, and I decided to begin looking for MPH level jobs with the state. And I had known that I wanted to work at the state level for a little while. So I started working as a disease intervention specialist, which is basically like doing contact tracing, but for sexually transmitted infections, or other infectious diseases like TB. So I conducted confidential investigations with people diagnosed with sexually transmitted infections and their partners to try to improve health outcomes. I also worked with individuals who were newly diagnosed with HIV to support them in getting care, as well as patients with HIV who were out of care and needed support getting back into care. And then a few months after starting this position was when the pandemic began. So my training had been a bit unconventional. And when the first cases appeared in New York of COVID-19, I volunteered to be deployed down to the command centers in Westchester County. And I also worked at COVID antibody testing centers and served as a liaison between local health departments in the state. So that's kind of when I started doing COVID work as well. So it was a bit unconventional in my training.
That makes a lot of sense. And first thing I want to highlight there is like, especially with nonprofit, will a lot of grant funded initiatives and how governments change and then their priorities change and then budget changes and the whole things get wiped out sometimes. Something that people in public health, I think, also need to be cognizant of, because that is a reality of the world, especially with like funding. And as we have seen, the public health emergency is over, so a lot of funding has been cut for public health work and a lot of funding streams going down there. So you were in New York during the start of the pandemic, working in this public health role. What was that experience like? when things, yeah,
It was
shit.
a whirlwind. It was a whirlwind. I, as somebody who, was really excited about public health and just starting my career, I was one of the first people in my office to volunteer to go down and work the command centers. And it really was a look into the public health system and how, we were going to react to an epidemic. So I went down to Westchester County, which is where the first cases were. And, we were working 12-hour days, 7 days in a row. And it was exhausting. It was an exhausting experience. But I'm also really glad that I had that experience because it was what I wanted to do. I mean, respond to an epidemic that was, like baby's first epidemic. You know what I mean? Like that was that was so exciting for me professionally to learn how to manage something on that scale so early in my career was something that I really valued.
Yeah, it's essentially a once in a well, hopefully once in a lifetime thing to happen. And yeah, I think it's something that a lot of public health people, not like they look forward to it, but these are the types of situations that we are trained to do and do this work. And like, firstly, let me not forget, like, shout out to you for like volunteering yourself during a time when so much was unknown to do this work, to say, okay, I have my epidemiology degree, my MPH degree, and this is what I'm trained to do. Let me do this work, and like very, very important things. And what was going through your mind when you were volunteering?
I started out pretty confident, and there were definitely moments where it got scary. They weren't recommending that we wear masks yet. It was so new, and we would be actually the Army Reserve, I believe it was the Army Reserve, came in to help and staff the command center that I was at. So I was, helping to train the Army to do the work that we were doing. And there were some other people from other regional health departments coming in to help. And slowly, contact tracing was starting. And slowly, every so often, we would get somebody in the command center would get a call saying that they were someone who was exposed and, they'd have to leave. And that got really scary for me. Especially, like I said, I have a brother who has a lot of health conditions and is immunocompromised. So, not that I was living with him at the time, but it just all became very surreal. Thinking about the different ways the situations could play out, and people that am I going to get sick? Am I going to get somebody else sick? Because this is so new. And there were definitely moments where it was scary, but I did stick out my time there, and I felt supported by the person running it. They did let me know, if you feel uncomfortable at any time, you can go, and I really valued that support.
And now a quick break from our show sponsor. Do you care about public health and health equity? Have you been looking for value-based apparel? Well, the Public Health Store has got you covered. Rock simple, value-based design apparel that will surely have others interested in engaging in meaningful conversations with you. The Public Health Store has apparel for you to rock in class, around the office, or just casually around town. Wear your values where people can see them. Visit the Public Health Store at thephmillennial.com/shop. That's thephmillennial.com/shop. And use the code podcast for 10% off your next order. Okay, now back to the show.
And I'm happy that that was the culture that we had there.
Yeah, sounds like some great leadership, especially in times of chaos, one would say. But once again, shout out to you and everyone else that took time to volunteer and do that work, especially early on in the pandemic. Yeah, because I couldn't imagine, because I was only seeing things on the news from, because I was in Alaska when everything like started unfolding. And yeah, it was pretty crazy at the beginning. So I could only imagine what was going through like your mind and everything. But hey, thank you for the work that you have done. We appreciate you a lot, a lot.
Thank
Um,
you.
yeah, you're most welcome, and I'm happy that like we've moved on to, well, not moved on, but we've moved to a place where you are able to do work that's outside of COVID-19,
Yes, me
which
too.
yeah, which I'd imagine you're also happy about. Okay. And so from public health representative, you got promoted or shifted into epidemiologist position. So was it a promotion? Was it a shift? And then what do you do in this position?
Yeah, it was. It was a promotional opportunity. It was, when you work for the states, there's different grades that are assigned to each job, so it was an increase in my grade, um, and that I found it's interesting. There's so many different ways that you can come into governmental work. So I found this through a nonprofit agency called Health Research Incorporated, which employs individuals for grant funded positions for the state. And so my disease intervention specialist job was through that entity. But when I got promoted to this position, it was funded through the state. So I shifted to the state funded position. And I think it's important for people to know that there are a lot of different paths to working for the government, whether it's grant funded, whether it's as a contractor, whether it's through the entity itself. So I found out about this job while I was working as a DIS, and it has been really foundational to the work that I do now as an epidemiologist, having been a DIS. In my division, there was a posting for an epi position, so I had contacted that office to get more information about the position, and I applied. And I think that they saw that my previous work as a disease intervention specialist, or DIS, I think I'm using those terms interchangeably, but that's what that stands for. I think they saw that as an asset coming into this position. So I'm really glad that I had that previous experience as a disease intervention specialist going into my epidemiologist position.
Yeah, just taking the stepping stones to get where you are. And so you're not doing COVID-19 work. What type of work do you do as an epidemiologist currently?
So in my current position, I conduct sexually transmitted infection related surveillance and reporting. So my team and I are responsible for data management and evaluation of the state's STI data. I also maintain data regarding congenital syphilis and prenatal syphilis infections, which are an important priority nationwide right now because both syphilis and congenital syphilis rates are increasing all across the country. Another big part of my job is assisting local health departments with any STI related questions or concerns regarding surveillance or reporting that they might have. And then in my position, I'm also a member of a subcommittee for expedited partner therapy, and that exists to promote EPT, or expedited partner therapy, in New York State. And then I was also first author on an abstract that was selected for oral presentation at this year's CDC's 2022 STD Prevention Conference, which is this week. So that's been really exciting opportunity that this position has given me.
Yeah, congratulations. That's amazing.
Thank you.
Do Okay, well, I appreciate everything you share there. You're doing a lot of great work. I think it's awesome that you also highlighted, and I need to stop saying awesome. And it's great that you highlighted that you're able to work at government level at different levels. There are different ways to be involved with the government in this work. And it's cool that you also like share that you're doing work to support local health departments, and you're a state funded position. So that's awesome. I think it's very important. I don't think we talk enough about syphilis, so congenital syphilis and different things like that, which you said is trending upwards, which is not something that I knew particularly. And I guess like to that point, are there anything that you say to people to maybe like just generally try to trend it downwards?
I think a lot of people think of syphilis as like an old timey disease, and they don't really know that there's such a risk of it right now. So I think just the first step is letting people know that it's on the rise again all across the country, and that when they're thinking of safer sex, that they should also be keeping syphilis in mind, because so many people think of it as something that doesn't happen again. That doesn't happen nowadays. So just even that first level awareness of this is happening to people, and it also used to be an infection that we predominantly saw in that in communities where there was a lot of maybe sex work or, in the MSM population. And it's all across the board right now. It is rising everywhere. Actually, we're seeing a big rise in heterosexual female or people reported as female infection right now, which is lending to the increase in congenital syphilis as well, which is a really scary outcome. So just that base level knowledge that people may not know that syphilis is, has made a comeback is something that people should know.
Yeah, so perfect public service announcement. Everyone, syphilis is an issue. Test yourself, be protected when you're having sex, test regularly, have conversations with your partners, your sexual partners. Yeah, well, I appreciate you sharing that because I did not know that. And now everyone of my listeners knows that. So I appreciate that. And then earlier in the podcast, you identified as fat, and you also said you wanted to speak more about, like, well, you didn't say it, but I'm going to ask you. You shared about medical fat phobia, and there was something else, medical something. And I wanted to like give you space as a public health professional to share more about this, or like, yeah, just to share more, and then we can go from there.
Thank you. Yeah. So we know that there is a lot of provider bias in medical fat phobia, where a lot of concerns are contributed just to somebody being fat. I know, a lot of the fat community likes to stay away from language like obesity and overweight just because they kind of pathologize fatness. But we know that health contributing behaviors, despite whether somebody loses weight or not, can have an improvement on, somebody's, health markers. It doesn't necessarily have to do with the amount of fat on their body. We can have health affirmative behaviors and not focus on weight. And I think so many fat people have had such disordered relationships with food and with exercise. And there's a lot of science now saying that, that can be more harmful than being fat, that yo-yo dieting and weight cycling, and how that really triggers, cortisol to spike, and it does a lot of harm to the body. And I don't think that the medical community gets enough education on nutrition and exercise in general. So there's a lot of really fantastic anti-diet nutrition professionals out there. I think, a lot of them call themselves anti-diet dietitians or anti-diet nutritionists, that are doing some really great work, that I think, we should really pay attention to, because there is so much that gets missed when it's immediately pathologized as fat, because that's, in my experience, the first thing that a provider goes to is like, well, you should lose some weight. And in reality, there's people who have, and this has happened, who have had cancer missed because they've just been told to lose weight. Or people are coming in who are fat and are saying, I'm losing weight at like, a time frame that I'm not comfortable with, like I've lost all this weight. And it's really because of a medical issue, and instead that they're just applauded that they're losing weight, when in reality, it's indicative of something going on in their body that's not right. And when I had thyroid cancer last year, and I remember being so worried that my provider was going to somehow blame me for my cancer because I was fat. And I ended up having actually a really great provider. And I do a lot of research before going to different providers now, just to try to make sure that there's some weight neutrality maybe in their practice. If not, the health at every size movement is kind of what people may look for in providers, health at every size, meaning that, you can pursue health at any body size. And that's something that I look in for providers now when I'm looking for new providers.
Well, I appreciate you sharing that a lot. That I think that in itself is like a whole public health lesson there. And it just shows like how distorted our medical norms are, our societal norms are. And just for you to have the thought of, okay, this thing is threatening my life, but I'm going into this space. I'm supposed to be helped, but I'm concerned that they're going to blame me and name something that doesn't even have to do anything with what is actually happening as the issue here. And I think that's something that we have to really become self-aware of. And I think it's very important. Like, yeah, like weight does not mean like you're healthy or not healthy. I know many skinny people who are living very unhealthy lives in many ways, as opposed to someone who just might have the genetics that it's harder to lose weight or whatever the case might be.
Yeah,
So I appreciate that, and I think it's important to have these types of conversations, and then go
absolutely.
and then going back to like you vetting your doctor. So even with like health at every size perspective, and then you're also queer, how what are the ways that you vet doctors? Because I think that's also important, because as I said, you're going into the space where you're vulnerable, and like you want providers that are supportive and that can actually like meet you where you're at. And before I forget, I I hope that you beat thyroid cancer. Yes.
Yeah, it's looking pretty good so far. They removed it, and I'm still going for scans and surveillance just to make sure that everything is looking good. But I'm about a year out, and it's looking pretty good. Thank you.
Well,
Um,
congratulations, and we hope
you.
that that continues. We're going to be keeping you in our thoughts and prayers, and we
Thank
need you
you.
around. So keep strong, keep
Thank
strong.
you.
You're welcome.
But we do know there is a lot of research that has shown that fat people put off preventative health visits because they are worried about the judgment that they're going to get from their providers, the judgment that they have already gotten from their providers, and that they're worried they're going to go to the doctor and just get talked at about their weight. So we know that people do put off preventative care because they're afraid of those things, and that's not something that I was comfortable doing, knowing that I have a lot of pre-existing conditions. So I had found some providers that I was comfortable with, but when I moved up here to Albany, I knew that I was going to have to get all new providers. So again, I really leaned on the fat community, and I love how social media has given us different communities that we can lean on like that. I asked a lot of questions in a lot of different groups that, support health at every size. And I asked, who have you trusted in this area? Who should I maybe stay away from? What have your experiences in the capital districts in New York been like? And I kind of just trusted my community members to help me find a landing point to start looking up different providers and their specialties and stuff like that. So I really leaned on my community to help me with that, and then looked up those providers, tried to get a sense of what their values were, and kind of chose them from there.
Okay,
And there
that
are directories for health at every size providers. Not really in this area. I think it's more, larger cities that people, make directories like that. So I unfortunately wasn't able to get any help from a health at every size directory. But, for people who live in really large cities, I would definitely recommend looking for, provider directories like that.
yeah, that makes a lot of sense. I appreciate you sharing that, and I think it's a disservice that we have so much technology in this world, but we can't have directories for stuff like that for in every place, which I think is just necessary regardless. Okay. Well, I appreciate you sharing that. Greatly appreciate you like being transparent and sharing your perspective as a public health person and someone that identifies in that sense. And I love health at every size. I think that it's a concept that we need to incorporate from a very young age, because I think, as we can see right now with the social norms and social media having some detrimental effects, like to your point, that like I think it's definitely very beneficial. A lot of people found out about me through social media, so I can't like be too negative against it, but I do acknowledge that it does have some detrimental effects for people and their health. Okay, but before I move you on to the last section of the show, I wanted to ask you, where would you like to see yourself in the future?
So while a lot of my experience has been in sexual and reproductive health, and that is kind of my comfort zone, I do think I'd like to at some point break out a bit and experience some other infectious disease areas. I would really love the opportunity to implement One Health in the work that I do. Um, I'm currently looking at the possibility of completing a certificate in surveillance and preparedness through the local school of public health. And then there's a little part of me that's also interested in pursuing a DRPH, but we'll see.
Okay, yeah, we will see. We'll definitely follow along on that path. And I don't know if anyone else caught it, but you said break out a bit and do more infectious disease. Break out, kind of like pun intended, that infectious disease is a breakout.
Yes.
I don't know if you intentionally did that or not, but that was
Love
awesome.
it.
I appreciate you saying it. Okay. Well, we look forward to seeing like where you do end up in the future, and if that is a DRPH or if that is shifting out of STIs and doing other work in public health, we all look forward to it. And yeah, so thank you for sharing that. So moving on to the last section of the show, the Furious Five, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
So I think trying to get as much experience in the field as you can so that you can try to find what you enjoy doing. Of course, I would love to see more paid internships in the area of public health. That's, I think, an issue that I see. There's so many other industries like in STEM where we have paid internships, and I would love to see that happen more in public health so that people could have more experiences. But getting that experience, seeing what you enjoy, and then having a mentor is also incredibly helpful.
Yeah, great advice. And to your story, like getting those internships is important in figuring out your path, which is important. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
I think that there's so many paths into public health and that none of them are right and none of them are wrong. It doesn't matter how you get there. And our public health community shines when we have a diverse, multidisciplinary team. So whatever brings you here is going to be an asset. Like I said, you might not always be on the perfect path to public health like I did in majoring in psychology, but I still think that bringing what I learned into public health was an asset. So whatever way that you get here is how you get here, and it's the right way for you. And again, if you are interested in a government position, looking at those different paths into government work can be important. Speaking to people who are working for the government and asking how they got there. Again, there's so many different ways to work for the government, whether as a contracted employee, a grant-funded employee, a state-funded employee. Look for people who have positions that you're interested in and ask them how they got there.
Absolutely love it. Love it. Number three, what's something you're working on improving in your life right now?
That's a good question. I think grounding, getting outside more. Like I said, I've been enjoying hiking. It's been really helpful for my anxiety, especially working on COVID-19, doing more hiking, and it can be hard for me to break routine and get myself out there on my own. So I think that's something that I'm gonna keep working on. And then, like I said, I want to work on that surveillance and preparedness certificate and look into DRPH programs. So I'm gonna keep looking at those.
Awesome. I hope that you're able to achieve that and do more hikes. Do you hike when it's snowing?
I haven't yet. Okay, so this is like a geeky pandemic thing that I got. You know how we all like got different hobbies during the pandemic. One of mine was foraging mushrooms, like wild mushrooms, and looking for them and identifying them and stuff like that. So that's how I've gotten myself into hiking, as I go out and I'm like looking for mushrooms and stuff. So I hadn't in the winter because there aren't any mushrooms usually in the winter. But I found a body liberation hiking club that I have been going to, and it's people of all different shapes and sizes and abilities helping each other hike. And a few of the people there have tried snowshoeing, so I did say that that's something I might try this winter.
Okay, awesome. Well, I hope that you're able to do that and have some fun with it too. I haven't done snowshoeing as yet, but it's something that I do want to do at some point. Number four, professionally, do you recommend anything?
So I love podcasts. I'm a big podcast person. One of the podcasts I mentioned in the beginning of the show, This Podcast Will Kill You, is an epidemiology podcast that goes over different diseases and concepts each episode. So professionally, that's something that I've really enjoyed. There's another one out there called Maintenance Phase that I really enjoy. And that delves into diet and quote unquote wellness culture and kind of debunks all of the junk that we hear. So I really enjoyed that. And kind of in the same vein, a book I think everyone should read is Fearing the Black Body. That's a book that I've been working through and I'm learning a lot from, and that is about the racial origins of fat phobia and the intersections on race and gender and medicine, and the perception of Black and fat bodies. So that's another book that I really recommend. And for anybody else who also really enjoys learning about sexually transmitted infections, Strange Bedfellows is a really good book. That's a fun book that I read this year on the history and science of sexually transmitted infections by Dr. Ina Park.
Yeah, thank
So
you.
those are some of my favorites.
Yeah, that's awesome. That's a great list. I'll definitely add it to the show notes for anyone that isn't interested. And I know earlier that you said there were some anti-diet nutritionists, anti-diet dietitians that you follow. Are there any that like stand out that you wanted to share? Or
I'm trying to think. There's a really, if you like go on Instagram and you put that in, there's a plethora of them that I definitely think that people should look up and just see who kind of calls to you and what feels right. Because I can't think of any names offhand.
Yeah, no worries whatsoever. And then if you do think of anyone, just send it to me and I'll put it in the show notes.
I will. Yeah, I will.
Okay, great.
Because there's some really great ones.
Yeah, well, I appreciate those resources there. And now, last but not least, where can people connect with you?
So I am on LinkedIn. My name there is my same name, Stephanie Parenti. Parenti is my last name. And then I'm also on Instagram. And it's a bit of a long handle, but it's self_love_and_science, which kind of combines my, I guess, my body liberation and love for science is kind of what that was meant to be a jab at.
Yeah, love it. And I'll definitely leave links for people to connect with you there. But thank you so much, Stephanie, for coming on and sharing your story. Thank you for the work that you did at the beginning of the pandemic. Definitely is very, very important. And I cannot overstate how thankful I am, and for I think everyone else who's listening as well. I think it's just really, really important. And I just appreciate all the insights and transparency that you shared on the show as well. So I appreciate that.
Thank you so much. I appreciate it.
Truly is my pleasure. And we will stay connected and we'll see where everything goes for you. Housekeeping items, everyone. Thank you so much for watching, for listening to this. Be sure to subscribe if you're not subscribed as yet. Leave a like if you're watching this on YouTube. Leave a 5-star review on any podcast platform and share it with a friend. It greatly helps the show get out to more people. If you'd like to connect in a community, you can go to Community Health and Wellness Discord server at thephmillennial.com/join and meet me there. Peace out, everyone.